Welcome student radiographer. Please execute print scan. Access granted. Good morning student. Your mission for today is to acquire a copy of Encik Izwan's chest x-ray, also known as your teacher. Your submission should include the following aspects: apex of the lungs, ribs. The deadline of submission is on 22nd of April 2018.
What is happening now? I should use my Shimama watch to check.
Ready to search. High KV technique detected. High KV technique is the primary controlling factor for image contrast. It controls the energy or penetrating power of the primary beam. The higher the KV, the greater the energy, the more uniformly the X-ray beam penetrating the various mass densities of all tissue. The higher the KV, less variation in attenuation, therefore low contrast.
When low KV technique is used, low energy X-ray photon will be released to the patient. High density bone will be absorbed more radiation. Hence, less X-ray photon will be received by image receptor. For soft tissue, they will absorb less radiation. Hence, more X-ray photon will be received by image receptor. For an example, if 70 kV is used in chest X-ray, the ribs and vertebra will appear wider, while the lung tissue will appear darker. Hence, the image shows high contrast. When high kV technique is used, high energy X-ray photon will be released to the patient. The high density bone will absorb lesser radiation because high energy photons are able to penetrate through the bone. Hence, more X-ray photon will be received by image receptor. For soft tissue, when compared to low KV technique, the soft tissue will absorb lesser radiation because high energy photons are able to penetrate through the soft tissue more. Hence, more X-ray photon will be received by the image receptor when compared to the low KV technique. For an example, when 110 kV is used in chest X-ray, both bone structure and the soft tissue will be more transparent. Hence, the image will show low contrast.
Ready to scan. Scanning passes back to center. In chest radiograph, high KV can be used to show more shades of gray, fine lung marking, reduction visibility of ribs, and faint outline of vertebrae through the heart and mediastinum. In obstetrics radiograph, high KV can be used to show the outlines of the uterus, the fetal fat and the bony parts, the site of the placenta, and significant fetal abnormalities. In hysterosalpingography, high KV can be used to show reduced scatter radiation within the body and decreased mean deposit dose to ovaries and testes. In barium examination, high energy X-ray penetrates adequately and increased visibility of barium field structure such as mucosa of esophagus, stomach, and duodenum. High KV technique also allows short exposure time.
Good job, my dear.
Sure, who am I?
Hey. Now, I want to give you another task. You have to analyze this X-ray film with Encik Izwan X-ray film that you stole.
Huh, boss! Why are you so cruel to me? Give me such a difficult task again. But since I'm Kim Possible, everything is possible. I will complete it within a second. Wait me.
Comparison of chest radiographs between the low KVP and high KVP. High KV image has low contrast, which results in more shades of gray. Ribs shadow is more transparent. The faint outline of vertebrae are visible through the heart and mediastinum, and easily penetration of mediastinal regions. Low KV image has high contrast, which results in less shades of gray, high contrast ribs shadow, and low visibility of other structures such as heart and mediastinal structure.
Since there is a lot of time, within a second, I found more information regarding to the advantages and disadvantages of the technique used in unchecked Izuan's image. You can check through our spy system, Shimama system. I go back first. Bye!
The advantages of high KV technique is better visualization of soft tissue areas or lesions superimposed with bone, since the bone would not be as dominant. More uniform bone visibility, reduce the dose to the patient, and give fast exposure time which frees patient motion. The disadvantages of high KV technique is that it infers the beam quality and the risk of over-penetration.
Well done. It seems that our project is going to be completed. Ha 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 ha.
You can talk now, but everything you talk will be a confession in the court.
Okay, you better shadow them. Hey, 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 hey.
Ha 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 ha!